We're at the American Academy of Ophthalmology in Orlando. My name is Sophie Bakri. I'm a retina specialist at the Mayo Clinic in Rochester, and I have the pleasure and honor of interviewing Dr. John Clarkson today. Dr. John Clarkson is the Executive Director of the American Board of Ophthalmology. He was formerly Dean of the University of Miami Miller School of Medicine and Chairman of the esteemed Bascom Eye Institute. Dr. Clarkson, thank you very much for agreeing to be with us today.
I'm honored to be included. Thank you.
As Executive Director of the American Board of Ophthalmology, you're obviously very involved in maintenance of certification. What's new in maintenance of certification?
Well, maintenance of certification actually began about 20 years ago as recertification, a process to reevaluate individuals who had been board certified by the American Board of Ophthalmology. And it is a process that now is present in all 24 specialty boards. It's evolved from from recertification to maintenance of certification, and beginning in 2012 will be a continuous process. And let me explain that. When it was first introduced, it was a process where every 10 years someone would be reevaluated, if you will, a second snapshot. But as it has developed in response to public concerns about patient quality, patient safety, it is now a continuous process where physicians will actually be asked to participate in some aspect of maintenance certification every year.
And how does maintenance of certification interface with PQRS?
Well, in the Accountable Health Care Act, maintenance of certification is included as a voluntary pathway to achieve PQRS if the particular board has a CMS qualified MOC program. Ophthalmology, as of today, does not have a qualified program, but we are working toward having it approved by CMS. So someone can participate in maintenance of certification and receive credit for PQRS at the same time.
Now, going forward, how do you see us measuring various milestones in ophthalmology training going from medical school all the way forward to being in practice?
Well, as you know, the ACGME established 6 physician competencies, and they apply not just to graduate medical education, but in medical school, and they will also be incorporated into the MOC program. So there are 4 parts to MOC, and as our program is evolving, there are going to be aspects of each part of MOC that apply to those 6 competencies. So we will take our cue from the assessment of these competencies in the training program and apply them in our MOC program. So basically all of medical education, undergraduate medical education, graduate medical education, and then continuing or lifelong medical education will have a means for assessing the 6 competencies.
Now, looking at later on in the training phase, ophthalmology is one of only a handful of ABMS boards that does not offer subspecialty certification. Do you see that changing?
Not anytime soon. The American Board of Ophthalmology has on 2 different occasions endorsed both fellowship accreditation, that would be ACGME accreditation, and subspecialty certification. Probably almost half of ophthalmologists who complete training today take fellowship training in one of the ophthalmology subspecialties, and probably 90% of practicing ophthalmologists limit their practice in one way or another. Yet we don't have a subspecialty certification process approved just yet. The ophthalmic, plastic, and reconstructive surgeons have applied for and received ACGME accreditation for their fellowships, and as the number of programs that receive that accreditation reaches a point that where there's a significant number of individuals who are interested in subspecialty certification, we will apply for subspecialty certification for that particular subspecialty. But as of today, there have been no other ophthalmology subspecialties that have approached ACGME or applied for fellowship accreditation, and that's the first step. You have to finish an accredited fellowship, ACGME accredited fellowship, before one could apply to the ABMS to achieve subspecialty certification. So I don't see, and there's not a lot of interest in that among the department chairs and program directors. So I don't see that happening anytime soon.
Well, Dr. Clarkson, thank you very much for enlightening us on all these educational issues, and it's been a pleasure having you today, and thank you very much.
Thank you.